Thank you. So thank you for joining us on this Friday afternoon. But first, I'd like to start by thanking our dear colleague, Quintero, who can't be with us because she's in India. She's the administrator of the Interpreters Division. Carol and I worked for many years together at Johns Hopkins Medicine, so that's where I know her from. And I also would like to thank Christina, who just introduced me, as well as Lorena, because they are also administrators with the Interpreters Division. So yes, as she mentioned, I have a bachelor's degree in Russian, a master's in Russian studies, almost had a doctorate in Russian history, but my advisor passed away while I was writing my dissertation, so I have basically nothing to show for it but the ABD, all but dissertation. And then I ended up 14 years ago switching into healthcare. I have a few healthcare examples, but since this is a more general audience, I chose to use a lot of different kinds of examples. So I want to start by saying this is a two-part presentation, so I'm hoping you'll be able to join us for the second hour of this. If not, that's fine. And then also, too, when I get home, I'm going to be posting the slides, so you'll be able to download them, as well as a resource sheet, so you can access any of the videos that I refer to, the case studies, any of the resources. So thank you again. So during today's presentation, we will look at some current language access regulations. We'll talk about the unique role of the interpreter as a language professional. What's the difference between a trained interpreter and Google Translate? That's going to be kind of interesting. What are some of the intercultural aspects of communication? The need for culturally competent interpreters as a strategy for improving language access, and those two really go closely together. And then in the second hour, we're going to talk about how our implicit biases may interfere with communication. So I'm someone who likes to use video clips. How many people have seen this video clip before? A few. Okay, so don't say anything, right? But I like this one. Sometimes humor is a great way to address difficult topics. And so I'd like to start with this video clip.
Hi there.
Hi.
Nice day, huh?
Yeah, finally, right?
Where are you from? Your English is perfect.
San Diego. We speak English there.
Oh, no. Where are you from?
Well, I was born in Orange County, but I never actually lived there.
I mean before that.
Before I was born.
Yeah, like, where are your people from?
Well, my great-grandma was from Seoul.
Korean. I knew it. I was like, she's either Japanese or Korean. But I was leaning more towards Korean.
Amazing.
Hamshasina. There's a really good teriyaki barbecue place near my apartment. So I actually really like kimchi.
Cool. What about you? Where are you from?
San Francisco.
But where are you from?
Oh, I'm just American.
Really? You're Native American?
No, just regular American. Oh, well, I guess my grandparents are from England.
Oh, well. Hello, Governor! What's all this then? Top of the morning to you. Let's go sporty. Double, toil and trouble. Mind the gap, beware Jack the Ripper. Bloody hell! Pip, cheerio! I think your people's fish and chips are amazing.
You're weird.
Really? I'm weird? Must be a Korean thing.
Is that all the videos are available, they're publicly available. They're on YouTube, so you can use them at any time you would like, at a staff meeting, a training, just for fun, to start off something. So let's start with just a few current language access regulations, and it's not a comprehensive review of these, a couple of federal ones, and then I'm going to ask you to share some because these vary actually from state to state and depending on what field that you actually work in. So one big thing is, why should we even care, right? Everyone in this room is an interpreter, but what's interesting is this came out last year, 2016, and what it says is the Census Bureau reports that at least 350 languages are spoken in US homes. I don't know if our colleagues outside of this field recognize that, right? I don't think they do. Have any of you heard Oh, English is the official language of the US. Have you heard colleagues say that? Right? The US doesn't have an official language. We're not like, say, Canada, where it's both French and English, or other countries. No, it's not the official language. We don't have one. Some counties have tried to pass laws to do that. Some states have tried to do that. But from a federal level, that's not the case here in the US. And then why else should we care about language issues? Well, every single one of us brings multiple components of ourselves to every single encounter, whether you're working with your other colleagues who are interpreters, people who are in the translation field, or whatever field you're working in, whether it's the judicial system, our educational system, healthcare, social services, law enforcement. Whatever field you happen to be working in, every single person belongs to multiple different groups, and we'll talk about that a little bit later. So if we start with a big one, Title VI of the Civil Rights Act of 1964, what I really wanted to do with that is basically it says that any agency or any entity that receives any sort of federal funds cannot discriminate against people based upon their national origin. And for our purposes, that means what language they speak. Now, what's interesting about this, because I do this work, when I'm out and about traveling, I like those Title VI signs. So next time you're, say, on public transportation, look, you will find one in the metro station. You will find one in the airport. You will find one when you're in a hospital. You will find one of these signs in a social services agency. And they'll say, yes, you have a right to an interpreter in your language, et cetera, et cetera. There might even be a poster, maybe with their top 15 or 20 languages, right, saying, point to this and we can get you the interpreter you need. That's where that is coming from. And then also from a federal level, we have Executive Order 13166, which came out in August 2000, and that reiterated this federal mandate. And a website that I really like, which I'm sure many of you are already familiar with, is www.lep.gov. They have great video clips on there. There is, and it's a bit dated now, but I think it's very helpful. There was a DVD that the Department of Justice produced. I'm going to say it was mid-2000s, and they used different scenarios on when an interpreter was not used and how that situation went very badly, and then how it was much better with the use of a trained interpreter. It starts off with a 911 phone call, and it's a grandmother calling. She speaks Spanish, and the 911 operator can't understand her, and it ends very badly. There's a situation with police where it's a Russian-speaking neighbor and her English-speaking neighbor doesn't like her. There's a dispute. The police don't call an interpreter. There's a situation in a hospital. A Vietnamese gentleman goes to the emergency room. They don't have an interpreter. He has an adverse drug reaction because they don't know what his medical history is. They have a woman who speaks Mandarin going to a social services agency, and they don't have an interpreter, and so she's unable to fill out the proper paperwork. So it's a great training tool. Some of the video clips are out on YouTube. I'll provide that in the resource list as well, but they're very helpful for people. I mean, I'm preaching to the choir, obviously, being here, being at this conference, but outside of these walls or outside of this conference, there are still many people who don't understand why having interpreters are crucially important. And then also, too, there were other laws that vary based upon the state that you may be in or the field that you're working in. And as Christina mentioned, because I work mainly in the field of healthcare, yes, we know the Affordable Care Act is up in the air. Who knows which way the wind is blowing these days? But there is a section in there, Section 1557, which reiterates the requirement to use qualified medical interpreters. Also, we have the culturally and linguistically appropriate services standards, or the CLAS standards, which came out originally from the Department of Health and Human Services in 2000, and then the enhanced version came out in 2013. You'll be amazed as I'm going out doing trainings at medical schools, nursing schools, schools of public health, pharmacy, and then with hospital administrators, executives. Most still have not heard of the CLAS standards. And they've been out since 2000. So we're talking 17, 18 years later. They're like, what? What does that acronym stand for? What does that mean? So that's very frustrating for me. And then also, too, some states do provide for reimbursement of interpreter services in the healthcare arena. Some state Medicaid plans do that. But again, a lot of this is really based upon if you work in criminal justice, there may be certain legal requirements there regarding interpreters. If you work in healthcare, there are requirements. If you work in education. Yes, and that's another thing I should say. This is meant to be interactive. Feel free to jump in at any time, and when you say something, I'll repeat it back because it's being recorded. So yes, go ahead. Yes. No, they don't. It is, sadly, it really is a state-to-state basis. So the National Health Law Program, NHELP, they're very helpful. They've done webinars, they've done white papers on which states actually have Medicaid reimbursement. So I'll make a note to include that because, again, a lot of these reimbursements you wouldn't know about because one is they really don't want to pay for this kind of thing. So the fewer people who know about it, the better in a way, because not for our purposes, but that's money they don't have to put out. And as you said, medical offices will complain, rightfully so in many areas. This is an unfunded mandate. You expect, the cost of the interpreter is more than I get paid for my office visit. How many of you have heard that, right? It's a big issue. But then also, I have young children and they're in educational systems, and I think of people who are going to the school and they don't speak English, and their child has an individualized education plan or an IEP, and states will say, oh, well, we had an interpreter on hand, the person understood, but even if you speak English, if someone explains something to you and you don't have a piece of paper perhaps, or you don't know what the plan is, are you going to remember that your child is in the diploma track rather than the college graduation track, right? These are big issues. And I actually come to you from the state of Maryland where 2 years ago, legislation was passed requiring that certain documents actually be translated into the language of the parents because of this exact issue. So we kind of covered this a little bit, but in the fields that you're practicing in, what are some laws or regulations that you're actually seeing related to language access? Yes? For you, it's Title VI. And what area are you working in specifically? Social services, yes. Title VI, definitely. Excellent, thank you. Public schools, yes, absolutely, right. And sadly, even though we have Title VI, some of that's being chipped away too, because some of this actually falls under the disability legislation as well, and a lot of that's being withdrawn, so that's not going to help the situation at all. Other areas? Yes?
Medical interpreting.
Medical interpreting.
In New York City, all hospitals are required to have a language access services department.
Excellent. So he's in New York City, right? New York City, all hospitals are required to have a language access services department. So some of these legislations you can see, some of it's federal, some of it's state, some of it actually gets down to the city or the local level. Thank you. Yes?
The Court Interpreters Act.
The Court Interpreter, yes.
Federal courts.
Okay, excellent. The Court Interpreters Act for federal courts. Thank you. I saw another hand up there. Did I? Yes? Due process at the state level as well, right. So if you think of, if you're in our court system, not knowing what your rights are, right? Or you're going to a court case and you have no idea what is going on, and people are making decisions about you without you. It happens in healthcare, it happens in education, it happens in social services. So we all know why it's crucially important for us to have interpreters. Now, on the one hand, it's great to have the laws and the regulation, but is anyone encountering issues with enforcement of this, right? Of course, you should all be in high demand all the time, right? But how many times do people, and we'll talk about this a little later, not actually use the services that are available, right? Well, I can get by with my limited whatever language skills, right? I'll draw pictures, right? No, that's not good. Or I'll use a child, I'll do that, right? No, it's very bad. And we're gonna talk about Google Translate, Babelfish, things like that, things that were supposed to replace interpreters and translators, which will never happen, but many people thought that. So the unique role of the interpreter as a language professional, and I think that's something that gets lost. I think people forget or want to ignore the fact that you are all professionals. You have gone through training. This is a unique and specific skill set. Not just anyone can become an interpreter, right? So as Christina mentioned, yes, I speak Russian. I also speak French and Spanish, and I read German very poorly. I sing in a variety of different languages, Ukrainian, Yiddish, Greek, etc. I am not an interpreter. Just because I speak a language, I'm not that warm body in the room that someone should pull in. Hey, could you interpret on the fly for someone in this court case? I know I am not qualified to do that. However, many of my colleagues will rely upon any warm body in the room to facilitate the service, and they are not professionals. So I apologize in advance if you've seen this video, but your administrator for the interpreter division, Cara Valandia, have any of you seen the video that she did a couple of years ago when she was at Hopkins? Did she ever show it to the group? She didn't? Okay, so this will be the premiere. This was saving lives in many languages, and it's basically getting at use the person who's trained to do the job, versus no one would ever walk into an auto mechanic and say, oh, I know how to be an auto mechanic, I'm gonna fix your car, right? No, you let the person who knows how to do the job do the job. So this came out, I believe it was 2014 or 2015. And again, this is available on Vimeo, so it's publicly available, so you'll be able to access this.
Hi, I'm Carol Velandia, and I would like to speak with you about how the lack of professional interpretation can cause serious risks to patients with limited English proficiency, or LEP, and how our department, Language Access Services, is addressing this issue. Approximately 25 million people in the United States are defined as being limited English proficient. This limited English proficiency and the lack of use of professional medical interpreters leads to medical errors based on poor communication during diagnosis and care.
Oh, hey, Marla, you speak some Spanish, right?
Yeah, enough to get by.
Oh, great. Could you help me with this patient in this room?
Sure.
Oh, great. Marla, can you ask her what brings her in today?
Señora, ¿qué pasa?
Me duele mucho la cabeza. Creo que estoy intoxicada por algo que me comí anoche.
She thinks she's intoxicated.
And you may remember that case, right? The $72 million lawsuit.
More frequently, LEP patients may not understand how to take their medications, or how to prepare for surgery, or understand what is involved in the procedure they are about to receive. The root causes of patient safety risks for LEP patients are related to communication errors due to the lack of qualified interpreters.
Excuse me, you're his sister, right?
Yes, I am.
Oh, that's great. Are you able to help me interpret a little bit what I need to tell him today?
Yes, sure.
Okay, so I have some bad news for you. Today we did get some tests and it shows that you have cancer. And the kind of cancer you have is called sarcomatoid carcinoma.
Bon, docteur, explique-moi, qu'est-ce qui se passe?
Oh, great. I learned French in high school. I know enough to get by.
Let's stop for a second. Couldn't this be as potentially harmful as...
Interpreter, what are you doing?
It's okay, doctor. I can handle this. I've seen it done on Grey's Anatomy so many times. Plus, I was trying to save time till you get here.
I already translated the discharge instructions in Google Translate, and now I can give it to the patient.
There is no need for you to go through these hurdles. Our language access team can help. Our group of dedicated operations specialists and interpreters will help you with your request.
Johns Hopkins Medicine International, this is Tom speaking. How may I help you? Okay, you need a Nepali interpreter? Over the phone or in person?
We offer services 24/7, and you can get a telephonic interpreter within minutes of your call. If you dial 410-614-4685, one of us will help you with your request.
Aside from being fully proficient in at least 2 languages, our medical interpreters are professionally trained in medical terminology and interpretation skills. They abide by the national standards of practice of the National Council in Interpreting in Healthcare.
Precisione.
Aselia.
Imparcialidad.
Samman.
Conciencia cultural.
Rule boundaries.
Professionalism.
التطور المهني.
Advocacy.
Our creed is no omissions, no additions, no editions. So you can be sure that by using a trained interpreter, you will be able to interact with your patient as if he or she spoke your same language. This guarantees that they have the same access to healthcare with the same high quality as an English-speaking patient.
Now who's going to help me?
Órale, ¿y ahora quién me podrá ayudar?
Super chica?
Beyonce.
No, Spanish interpreter. Language access services, saving lives in many languages.
So what was interesting about that, you notice that the doctor, the person playing the doctor, actually used the term interpreter, right? Because my pet peeve, again, doing this work is, wait, interpretation for oral communication, translation for written communication. This happens all the time on radio programs, television programs. How many times do you hear people referring to the work that you all do as, I called a translator, or the translator did whatever, and it's like, no, it's an interpreter. So, you know, when I do these trainings, I say, interpreter does this, translator does this. They're very different skill sets. You need training for both. So some people can do both and they've received training, but you can't expect the interpreter to, on the fly, hey, could you also translate these discharge instructions? Hey, could you also translate this court order for me? Hey, could you translate this IEP for this parent? No, you can't do that. So again, preaching to the choir. But so I hope that as you were watching this, though, you might have thought of some instances where you yourself or your colleagues weren't treated with the level of professionalism that you deserve, right? I'm sure some of this looked familiar, right? So would anyone be willing to share an example of an interpreter, of a situation when you were not viewed as a professional or as part of the team, and how the situation turned out? Yes, yes. Right, right. Judge. Right. So what she said is she had a judge who said, hey, I have to warn you, I'm bilingual, and then proceeded to correct her and was wrong. And that's a very difficult situation, because if you're perceived to being haughty or offensive, that could adversely impact the case, but that person was going beyond that person's credentials. That person is a judge. As that person is a professional as a judge, you're a professional as an interpreter, and the person should have recognized those roles. There was another hand, yes?
And eventually I started bringing my medical dictionary and showing her, look, it says that it's this way. Look, it says that it's this way. And she stopped.
Good. So what she said was she had a very similar experience with a doctor who didn't speak Spanish very well. People tend to overestimate their language skills, right? I'm sure you see this every day. Like he said, oh, I took French in high school. No, don't practice on people. I don't want someone practicing on me. Why should, right? So yes, so by bringing the medical dictionary and showing this is what the word actually is, that was a great strategy to get that person to stop doing that. Yes? And then I'll come back.
I had a similar experience to that with one of my doctors. I work primarily in the hospital environment. And I had a similar situation where one of my doctors said, oh, I don't need you. It's okay. You know, I speak Spanish. And I said, okay. If you don't mind, would you mind if I just stay here? Because maybe the patient may have a question, and I'll be more than happy. I said, please go ahead, doctor. And I literally gave her the floor to try to communicate with the patient. Needless to say, and to my greatest victory, she couldn't really communicate clearly with the patient. And the patient was not even understanding her pronunciation or what she was trying to say.
Right.
Especially when it came to the instructions that, you know, they had to give her as a part of her medical update. So I just looked at her, you know, and I was just standing calm and just looked at her, and she said, okay, that's fine, come along. It's my pleasure. I'm here, and we conducted the session perfectly clear. There were no questions, everything was clear. And I always have this habit, this is just a personal thing, you know, like my little pet peeves, as you said. I always have this habit of asking the doctor, would you mind if I ask the patient if he or she understood everything that I explained, that I interpreted for you? I don't know
Right.
I'm from a certain part of the country.
Yes.
The patient may not always be. And she just looked at me and she goes, yeah, of course, please go ahead.
So see, that's excellent.
That's the end of that.
See?
Ever since this doctor, I'm on duty 3 days a week. So this doctor calls our online services to request an interpreter to do her medical rounds in the morning.
See, that's excellent. See, that's excellent because, again, it's that case of, oh, no, I can handle it, right? But yet, remember, the doctor in the video was shocked. Wait, what are you doing? You can't. Wait, I've watched it. I can do your job. If you can do my job, I can do your job, right? Now, I thought you were going to tell me something else. One thing she does at the end, too, and I want to make sure I capture this for the recording, is that she was saying, she asked the doctor's permission, can I ask the patient, does the patient understand everything that I have stated? And then there's the opportunity for questions. Now, I did hear a case of very similar, letting the doctor kind of make a fool out of him or herself. When I took high school Spanish, people used to make a joke like, well, if you'd add an O on the end of it, an English word, it becomes Spanish, right? El floro, el chero, el tablo, el ceiling up, right? Yes. So this was a case of a patient with congestive heart failure, and the doctor was attempting to ask, what was your fluid intake? Which, by the way, in English, no one speaks like that. Even an English-speaking patient would be, what's my fluid intake? Okay, are you talking about for my car? I mean, it doesn't make sense. It would be, how much water have you had to drink? Have you had coffee? Have you had tea? That's a whole health literacy issue, or a literacy issue as a whole. So what the person did was made the mistake of, and I'm sorry, but for the Spanish speakers in the room, use the term flujo to say, yes, not good, instead to say fluid. And it's not the right kind of fluid. It's referring to vaginal fluid. So imagine the horrible position the interpreter is in, because you know the patient's probably thinking, what the bleep, 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 bleep. I don't trust my healthcare provider. This person doesn't know what he or she is doing. So that person has to do both damage control, right, and then reassure the patient, I'm here for you, and this is what I think the healthcare provider is saying. So how things can go astray. You in the front, I'm sorry, and then I'll get to you.
Well,
and you.
actually, I was an interpreter at a private meeting from Russian into English and vice versa, and I was employed by the Russian side. And the guy just told me, you know what, I know enough of English, so you just interpret what I say from Russian into English, but don't interpret the other guy from English into Russian. Well, okay, the client is the boss, that's what I was doing, but after about maybe 5 minutes, I understood the guy wasn't really getting what that person was saying. That's why he was asking like those really stupid questions, which really showed it. And well, I mean, the English-speaking guy saved me because he said, you know what, I think that it would be better if we do this normal two-sided interpreting.
Yes.
But it did happen to me more than once.
Yep. Again, excellent example. So in a private meeting, someone overestimating their own skills, and thankfully the other party stepped in and said, I would feel more comfortable doing this. Yes, you, and one in the back, and then we'll move on. Yes, go ahead.
It's interesting because for the credit of the medical professionals and judges and people like that, there's a varying amount of proficiency they have in the Spanish or French. And some of them are pretty good, but you know, it's just a wide range. But that's not the point. The point is that they will not be unbiased. And that's as important, that's a thing that a lot of them and some interpreters don't understand that's as important as whether or not how good they are in the language.
Absolutely. So what he was saying is that the people who are the medical providers or judges, legal officials, yeah, their language skills may be okay, but they're not going to be unbiased. They haven't gone through the training of the code of ethics for what is your actual role, right? So yeah, that's putting them at a huge risk. There was the one hand up in the back, and then we'll move on. Yes.
So I'm a court interpreter, and court reporters get paid $30,000 more a year than I do. Yet they are also language professionals. They translate in the generic sense of the word translate from English into steno simultaneously, where I translate from English into another spoken language simultaneously. So wouldn't this impact the LEP person that if I'm getting paid $30,000 less, it's going to attract a certain type of professional into the field of court interpreting that is not as, doesn't have the skill sets that a court reporter might have that's earning $30,000 more. And in that sense, the LEP person is getting video the difference between a bilingual and interpreter, oh yes, we see the difference, but shouldn't we also be seeing a difference as to the quality of interpreting within, and wouldn't the DOJ or some kind of a national organization want to ensure that interpreters should get paid what the skill set requires?
That's an excellent point. So what he was just saying is that in court interpreting, yes, you have the court reporter who gets paid $30,000 more than the court interpreter. And one, is that fair? Two, what kind of people is it attracting? I mean, yes, you can only do something out of the goodness of your heart for so long. I mean, you should be paid commensurate with your experience, your skills, your education, etc. And so, yeah, you would think, would the Department of Justice do something to equalize this, have more equity in the profession?
And how that affects the individual.
Right, and how that affects the individual. Right.
Whereas a court reporter is providing a transcript
For
the judges and the lawyers
right.
about that varies between 0 to 3% inaccuracy.
Right.
Court interpreters are tested between 70% and above, and in federal 80% above. So there's 20 to 30% fluctuation. Granted, spoken languages is cultural bound.
Right.
More difficulties, but
absolutely. Right. No, that's what he's saying is that, yes, the bench and the bar, the judicial profession is being better served than the actual client, the LEP person is. So maybe that should be something that the different associations can look at. Because I think what people forget, too, from the professional side is that there are certifications that people acquire. Just like someone's certified, board certified to be a doctor, well, someone's a certified court interpreter or certified medical interpreter, et cetera, et cetera. So why shouldn't that not be compensated for, and why are people not looking at that? And then there are all of the different interpretation and translation associations like this one. So that whole issue, the one came up in the video of machine translation, right? Does anyone remember about 20 or 30 years ago, and I'm dating myself, when people said, libraries are going to go away. We won't need books anymore. Everything will be digitized, right? Well, libraries still exist, and in many communities, they're pretty much a hub of action, right? So let's think of this from an interpretation as well as a translation perspective, right? Same thing. Oh, we don't need interpreters or translators. I can use Google Translate. I can use Babelfish. I can pull out my phone and text something and it gives me back some gibberish, but I'm going to give that to my patient, the parent, my client in the court system, the person in social services, and this will work and be adequate, right? That's not going to happen. Yes, people use this. So what's interesting about this is pretty much Google Translate fails. And I was trying to be nice with this because there are some really hilarious, just Google Translate fails. There are some that are not safe for work or not appropriate for a conference, but some are really, really humorous, and they really show you some of these huge Google Translate fails. So I was going to ask, I'm going to read the English, but I was going to ask if I could get a volunteer to read the Spanish to show you, wow, this wasn't even close. So this was a Spanish translation fail. It was a woman riding her motorbike in leathers stopped to give a light to a boy in overalls carrying a jack and a milling cutter. Do I have anyone who would like to volunteer to read what the Spanish is? Yes. Yes, and I feel like I should, if you wouldn't mind, maybe coming up and using the microphone so it gets recorded. And yes, and so you can see it. Let me give you the mic, though, if it will reach. Let's see how far I have. There you go. Thank you, Ana.
Una mujer montando su moto en cueros se detuvo para dar una luz a un muchacho en el mono llevando un gato y una fresa.
So, was it even close at all? It's not close. So we'll show you what it actually, how, when you put this then in Google Translate for the Spanish to try to get it back into English, it's a big fail. The way it comes out is a woman riding a motorcycle in leathers stopped to give birth to a boy in the monkey wearing a cat and a strawberry. Really close, right? Yes. What? Right, so nuance. Anytime you have nuance, anytime you have anecdotes, things of that, machine translation can't catch that. So this was just an example of this went very bad. So think of in your particular field, think of something where instead of using you, like I don't need someone to explain it verbally, I'll just do Google Translate and give them the piece of paper. What if this were a life or death situation? Do I get out of jail or not? Does my kid graduate on time? Do I know whether I have a cancer diagnosis or not? I mean, it can go very bad very quickly. So that's one. And then a French fail, and this is an example of how when the same word can be used, same word, but it means different things, it cannot handle this at all. So I'm going to ask for a French-speaking volunteer in a second. But in English, what it said was, the trainers wore trainers and left on trains. In French, would someone like to come up and try to do that one? Any volunteers? I see the sir with a French, is yours, are you French? Would you like to, or no, if so, if not, I can, would you? Oh, you want to say it in French? Would you mind coming up to the mic, though? In French, what it says in, what it attempts to say, I should say in French. Oops. So, yeah, can you read what's on the right there? Okay, thank you. Thanks.
Les entraîneurs protègent des entraîneurs et les laissent sur les trains.
Thank you. So, did they capture, for the French speakers in the room, did they actually capture what they were trying to say here? No, not at all. It's terrible, right? So, what happened was, it ended up saying, when they converted it back, it's the bottom here, it says, the coaches wore coaches and left them on the trains. That makes no sense. It's gibberish, right? But let's use Google Translate. No, don't do it. Right, we wouldn't, but think of the other people who would in a minute. And the last one I'll use, this one happens to be German. Would I have a brave soul who's a German speaker in here, German interpreter, who would like to read the German? And do we have any? None? And I read German poorly, I don't want to do it. Yes, would you? Oh, thank you. Because I don't want to embarrass myself. Thank you. Oopsie. There you go. Thank you.
Das Gericht hat das Angeklagten Kosten gekostet.
Thank you. Thank you very much. So, yeah, that didn't basically, what it was supposed to say is the court awarded costs to the defendant. So for the people who work in court interpretation, the court costs the accused costs. That means nothing. So it's terrible, right? So these are all just great examples of Google Translate fails. So I'm sure we can all think of many, but in the interest of time, I will keep moving if you don't mind. We also share some examples of untrained interpreters, so we kind of already did that. So let's talk about the intercultural aspects of communication. So I would argue that every single encounter, even if it's between English-speaking people or people who speak the same language or whatever, is still a cross-cultural communication because we all, the one person mentioned speaking Spanish, you gave the example, yes, I speak Spanish, but I might not be from the same region, and maybe we use a different word and maybe the person didn't understand. That's that nuance that many people do not understand, even when speaking English. So for people whose native language is English, you know that there are certain things that we all call different, depending on where you grew up in the United States. You might call it something very different, right? So I'm from Connecticut originally. So if you go to Subway, right, and you buy those things that they put on bread with, cold cuts on it, what do you call that thing? It's a hoagie if you're from Philadelphia. Philadelphia in the house, yes, okay, Philadelphia. If you are here in DC, it's a sub, right? You order a sub. If you're somewhere else, it might be a hero, right? A grind, oh, yes. Are you from, yes. So in Connecticut, yes, we call it a grinder. Don't ask me why, how, probably doesn't make much sense, right? Well, when I came to DC for college and moved from Connecticut, fail. This wasn't a Google Translate fail. This was two English-speaking people fail. Where can I get a grinder? Yeah. That did not end up well. It was not a sub shop. It was the red light district of DC. I think it was 14th Street then, 30-something years ago. We were speaking English. We used the same word, right? Same with if you want to buy alcohol, right? We would call it the package store. When I moved here and I asked, where can I find a package store? They sent me to, remember, mailboxes, etc., to ship a package. I didn't want that kind of package. I wanted the little other package. But we're speaking English. So those are nuances even in English, and it gets even more complicated when we're adding other languages. So I know you're all familiar of the scale, the ILR scale for competence. Think about where you fall on this scale and think of how it relates to intercultural communication. And the person who was talking about the Spanish, this is a prime example of, and this applies to probably every single language because there are regionalisms, right? Spanish isn't Spanish isn't Spanish. So how do you say supermarket? Well, it completely depends on what your country of origin is, right? Or what your cultural background is. And so if you were serving as the interpreter for someone and you used mercado for someone from Colombia and there was someone from Uruguay, it's not going to be, what is that? You know, yes, you're speaking Spanish, but you're not going to be able to understand one another. So that's an example. And then also, too, again, intercultural communication. So in the video, you heard about the patient saying intoxicado. And have most of you heard about that case, the $72 million case, right? In healthcare, I'm sure we have. Mistaking intoxicado, the false cognate, for intoxicated when it actually means nauseated. So the person wasn't suffering from a drug overdose but had an aneurysm and ended up a quadriplegic at 18 years old. So his family received a $72 million settlement. So it talks about the dangers of a single word. That was when I was saying about O being added to words in Spanish, supposedly. Well, this is the case of Rita Quintero. And it's actually hard to believe. It's almost 40 years ago. But she was found wandering the streets of Johnson City, Kansas. These were her characteristics. She was digging through trash cans. She was speaking incoherently. She was dressed oddly, but she only spoke a few words of Spanish. Well, what happened was she was picked up, brought to the Larned State Hospital, which is a psychiatric hospital, and she was confined there for 12 years. Because what happened is if they even used an interpreter, which in 1983, I'm going to say probably not very likely, right? They probably assumed that she spoke Spanish, and since they couldn't communicate with her, she must be mentally ill, right? So she was confined for 12 years, and they were finally able to secure her release. But what's really sad about this case is when they were looking through the medical notes, they found a note back from 1983 from the Mexican consulate, which said that this woman fit the description of someone from Mexico who was from the Tarahumara Indian tribe. So she spoke Raramuri, but very limited Spanish. So can you imagine losing 12 years of your life simply because the assumption is that someone speaks Spanish? And I know in healthcare settings, and I'm sure in many other settings, we assume, oh, the patient with the last name Rodriguez must be Spanish speaking, right? Well, one, that person could be someone who doesn't speak any Spanish at all, right? Depending on how it's spelled, the person could speak speak Portuguese, the person could be Filipino. You know, how many times have you been called erroneously because the person really didn't need an interpreter? But I just assumed based upon the name, right? So doesn't go very well. So then let's turn to how culturally competent interpreters can be a strategy for improving language access for the clients and the people who need it the most. Let's start with debunking a few of the myths, because there are some myths about cultural competence. So one is, and I don't want to be put out of business, but that's okay, but you just need a good cultural competence seminar or training to become culturally competent, right? Well, I do this work professionally, but I am constantly attending seminars and webinars and conferences. It's lifelong learning. It's not a one and done, right? And sometimes people's strategies are a check the box, and that can be a check the box strategy. Whatever field you're working in, don't you have to do annual updates on certain things, right? If you're in healthcare, let's do health, safety, and environment. If a fire breaks out, infection control, patient safety stuff, right? Well, how about this kind of stuff annually? But what happens is we don't do that annually. It's really, oh, we did it in new employee orientation, and then the employees who came on board after they implemented this in new employee orientation never got that information. Number two, oh, it only applies to interactions with racial and ethnic minorities, right? It's like, well, wait, where does that come from? You know, or we don't have a diversity problem here because we're pretty homogeneous. It's like, well, every single person belongs to multiple cultural groups, and we'll get to that momentarily. And then the other one, myth 3, being a person of color automatically means you're culturally competent. Wow, okay, so usually when the call comes out, we want a cultural competency champion or a diversity champion, and the person of color gets tagged. But what if that's the resident homophobe in your department? That person's not culturally competent in all different areas. And none of us probably is going to be culturally competent in every single area because there's a continuum and we're all learning. Yes, go ahead.
I have something similar, but I mean, it fits. I work for an office and there's a great deal of diversity. And a person called, we have different employees, one of them has a very thick English accent. A parent called with a very thick accent. So the receptionist wanted to connect them because you have a very thick accent.
Oh my goodness. Wow, okay. Right. So what she said, humor sometimes and some things you would never believe. So she said she had a colleague who had a very thick accent. And there was a person who called the office, the school office, who also had a very thick accent. So the secretary thought, well, okay, thick accent, they'll be able to communicate. I can't even respond to that one. But remember I mentioned the Department of Justice video, and I mentioned the Vietnamese patient who goes to the emergency room, a very similar situation. What they show is it's a Vietnamese patient. They call up a young lady, Boon Tan, who is a computer operator, and she's Thai, right? And they say, hey, don't you speak an Asian language? Could you interpret or could you translate for him, is what they say. And so you hear him talking, and you hear her listening, and it doesn't make any sense, and she talks, and he doesn't understand, and she's like, I don't understand him, but I think he's speaking Vietnamese. So she was able to get that part, but the assumption was, well, she's Asian, he's Asian, they must be able to communicate. It doesn't quite work like that. So, also, myth 4, that there should be just one person or a team in an organization who's charged with dealing with these issues, whether it's diversity and inclusion or just language access. Can you imagine if you only had one person in an entire agency or organization who was charged with doing this? No, this needs to be embedded into every aspect of all of our organizations, right? Next, well, cultural competence is too big to tackle. Yeah, there are all these different groups. I just want to ignore this. I don't need to do this, right? I'm sure you've probably heard that. Why can't they just learn English? Right? How many times I've heard that also, right? And then, well, I have so many other competing priorities. Addressing cultural competence, language access, interpreters, translators, etc. I don't have time for that, so you can do that. I'm not going to do that. It applies to you, it just doesn't apply to me. And that's what people do. So let's talk about the difference between cultural competence, diversity, and culture. So one is, what's cultural competence? So remember I said it's not I went to Cherie's session in Czech, I'm culturally competent. I am working towards cultural proficiency myself as an individual, even though I do this professionally. So it's a process, it develops over time, and it really is that lifelong learning. But it affects, yes, us as individuals, but also organizations as well as systems. And what I mean by that is because trainings are fantastic, they're great, I do them all the time. My concern with them is I can talk about strategies and I could go talk to the people who aren't interpreters and translators and try to convince everybody else, yes, this is why we need them. You need to do X, Y, and Z. If they go back to an organization and they refuse to use interpreters, like I say, don't use someone's child, don't use someone's neighbor, don't use Google Translate, but they go back to their organization and, no, don't use interpreters, they cost too much. I failed. Why did I have that training? I've set them up for failure. They cannot serve the needs of the people who are most vulnerable. So there's a whole continuum, as I was mentioning. So, and depending on the situation or the culture, we can fall any place on this continuum. And I, too, doing this work can, depending on the situation, because I'm constantly learning. So there could be things such as cultural destructiveness, see the difference and stomp it out. So that's that, why can't they just learn English, right? My family came here 500 years ago and they spoke English, and you're sitting here like, what? Okay, whatever, And it's like, wait, but they lived in neighborhoods where they were with other people who spoke their language and they didn't need to learn English. And why is it okay for your family and not other people, right? So that's one. There's also cultural incapacity. You see the difference and you make it wrong. So it could be the children, the undocumented children who are coming to this country from various Latin American and Central American countries. And basically, you could say, oh my goodness, why are they coming? This is terrible. Why are they coming to this country? But then if you think from a humanity perspective, or as a parent or a fellow human being, they're coming here for a better life. They're fleeing trauma. They're fleeing violence, right? You probably wouldn't stomp it out. Or if you practice empathy. If that were my child being traumatized, wouldn't I want my own child to get a better life? trying to flip it that way. Cultural blindness, see the difference and act as if you don't. Cultural blindness, color blindness, even that term about the US, we're a melting pot. Melting pot, though, means everybody's the same, right? And you have to throw off every aspect of yourself to assimilate and fit in, right? But why can't we celebrate the differences? Is difference bad? Or if I say I don't see color, do I not see you? We notice people's hair color, that someone has glasses, their weight, their height, but I don't see your color, or I don't see your culture. Well-meaning people say this one all the time. Cultural pre-competence is where you see the difference and you respond inadequately. So say if you're, and I know no one in this room would do this, but if you were in a setting and someone makes that comment, oh, I don't need an interpreter, these people just need to learn English, blah, 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 you don't know how to respond. Or when people tell off-color jokes, and usually people will giggle nervously or people will be silent. What do they say? Silence is complicity, because when you're silent, people assume, oh, you agree. So they'll continue making those kinds of comments. And then cultural pre-competence is where you see the difference, you understand the difference that it makes, and you're trying to make sure that we can somehow engage and include everyone regardless of their backgrounds. And the ultimate goal is cultural proficiency, and that's where now you now have learned tools and strategies so you can respond. So for example, if someone makes one of those off-color jokes, so-and-so, I don't really agree with that, or, that wasn't a very nice thing to say, or what if someone said something about your family or your group or whatever, Now, I will say the caveat with that is there are power differentials. If you're the person who is in the lower level of the organization, you're not going to be able to have those kinds of conversations. So for those of us who are in positions of power, regardless whether we're senior level people or the administrators or in the C-suite, we need to be the ones to basically keep other people in line so they don't make those kinds of comments. Because otherwise they'll think it's okay. And then dimensions of diversity. Basically, this applies to every single person. So what's that one thing that families argue over? It's assigned to us at birth, and it has all kinds of meaning. When you're born, there's something that's put on your birth certificate. Your name, right. So how many people have had your name, I'll say butchered, mispronounced, short? Most people, probably almost every single person in this room, right? Barbara becomes Barb. Michael becomes Mike. Oh, Juanita, I can't call you Juanita. I'm going to call you Joanna, right? Or someone who has, my daughter, when she was young, she had a Mandarin Chinese teacher, and her name was Wei Zheng. And I couldn't figure out why she always called me Wilson until, because my last name is Wilson, but I realized, oh my goodness, okay, Wei Zheng. So basically, first name, last name, her last name came first and then her first name. So she was using a sign of respect, but I didn't know that. So see, I'm learning too. So basically, I called her Wei Zheng. I didn't say, oh, I can't say Wei Zheng. I'm going to call you Jennifer instead, right? What I do is I ask people, is your name such and such, or could you pronounce your name? Because it feels terrible when people constantly mispronounce your name, right? And if you notice, if it's not I'll call it a standard name, people just don't even try. They don't, And it's like, it just takes 2 seconds just to ask, and then you move forward. Then we have things such as our physical characteristics. And then it's finding out, well, where were you born, or where did you go to school? What are your favorite sports teams? What's your faith affiliation, if you even have one? What's your profession, right? And then you move beyond that to what's your role in an organization? Are you an entry-level person? Are you union? Have you been there for many years? And then lastly, all the cultural things, right, such as time-orientedness. And with that, basically, something as simple as, so what culture is, it's this integrated pattern of human behavior. It's passed along from generation to generation. It's those stories that people tell. It's the things that are important to people, whether it's foods, whether it's language, customs, passed down from group to group. But what's interesting is something as simple as a greeting. How do you greet people when you meet them? What are some examples? Yes?
Depending on the culture, you will shake hands, you will get a kiss.
Yes. Yes. Yes, exactly. So what she said is, depending on the culture, you may shake hands, you may get a kiss, you may get a hug, you may get 2 kisses, you may get 3 kisses. It may be, oh my gosh, they kiss, okay, this one starts from the right, this group starts from the left. No one's expected to walk around with, okay, so when greeting this group, remember, How many of you have seen those, I don't want to call them cultural cookbooks, but that's kind of what they are, right? When dealing with Hispanic or Latino people, remember blah, 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 right? When dealing with Middle Eastern people, remember blah, blah, blah. You know, I've had people ask me that. We have a growing insert X group here. Can you tell us what we need to know? I'm like, not really. Because what I tell you runs the risk of cultural stereotyping. It might work for some of the people, and some of the people in the group might agree and do this, but you might then apply that to every single patient, and you're going to offend some patient because they're like, what? I don't do that. Where'd you, that's old country. We don't, right? So I don't like doing that. So every single one of us, though, belongs to multiple cultures. But what leads us astray, though, sometimes is that we focus on, this iceberg analysis is great, we focus on the external. And we're going to talk in the next session after the break about implicit bias. And it's that external that really leads us astray because we make assumptions of people we have something in common with based upon appearance. We could look at someone's weight and make assumptions about someone, right? But what we don't know is until you start talking to people, it's that stuff under the surface are the ties that bind us all together. So with that, we're actually right at 3 o'clock, and I don't want to keep anyone from the break, but if anyone has a burning question they'd like to ask me, you can go ahead, we'll do that, and then, because I think we started about 2 minutes late, but I want you to have that full half-hour break. So does anyone have a question? Yes, yes.
Do you recommend any cross-cultural or cross-competence models of training?
Depending on the field, so there's some in healthcare, like the LEARN model, and I'm trying to, it's an empathy model. Let me make a note, and I can include that in the resources. Yes, absolutely. But with that, I hope most of you will be able to come back for part 2, but we will resume at 3:30. So, and thank you for being a very engaged audience. Sure. References.